Wabarakatuh. Good morning to all the excellencies, lecturer, and all participants. Welcome to the guest lecture on innovative approach in global health, integrating research, policy, and technology to address emerging public health challenges. This guest lecture is presented by Department of Biostatistics, Epidemiology, and Population Health, Faculty of Medicine, Public Health, and Nursing, Universitas Gadjah Mada. Ladies and gentlemen, my name is Rizky Adinda, and we would like to welcome the Dean of Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. And we also extend a warm welcome to the professors and lecturers from Peking University. Welcome to Universitas Gadjah Mada, professors. And ladies and gentlemen, for today's guest lecture, we are truly honored to have three inspiring speakers. We will have Professor Yi Song and Professor Yang Mu Huang from School of Public Health, Peking University. We will learn a lot about the national surveillance and health equity in China. And we will also have Dr. Riris Andono Ahmad, MPH PhD from Universitas Gadjah Mada, and he will share about Wolbachia as the intervention for dengue control. Ladies and gentlemen, before we start, we will listen to the opening remarks from the Dean of Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, to Professor Dr. Yodi Mahendra Datta. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Ni men hao. Very good morning, everyone. Welcome to today's seminar. This seminar is part of our weekly seminars, which we organize for our postgraduate students. But today's seminar is special. It's a special edition. It's special because we have special guests from the Peking University School of Public Health. Now, if you check the media this morning, you may have heard that QS has just released the 2025 ranking. And if you check, you will see that Peking University is #1 in China, and Gadjah Mada is #1 in Indonesia. So these are two leading institutions in the respective countries, but also in the region. So we're really privileged today to have two presentations from Peking University and one presentation from Gadjah Mada under the theme of innovative approaches in global health, integrating research, policy, and technology. From Peking University, we'll have Professor Yi Song, who will provide insights into adolescents' health surveillance in China, highlighting the importance of priority indicators and addressing critical data gaps, which will underscore the need for robust evidence to inform interventions for an often overlooked demographic, adolescents, also here in Indonesia, often overlooked until now. And then Professor Yang Mu Huang will then explore the imperative for improving health equity in China and beyond, offering lessons that resonate across border, including here in Indonesia, where equity is also a major issue. And then from Gadjah Mada, Dr. Riris Andono Ahmad will present on Wolbachia technology for dengue eliminations, an innovations that combines cutting-edge science and community engagement to combat dengue. So to the students, this seminar offers you a unique opportunity to learn from these world-leading experts, to engage with them, to engage with their ideas. By engaging in the discussion, you will also be taking part in our initiative to establish partnership between Peking University and Gadjah Mada. And if you're fortunate, after this, you may have further opportunities to take part on the joint projects which we are now planning, or perhaps after you near future, that's also a possibility. morning with us. And thank you to our students for taking part, for enthusiasm, and thank you everyone who made this seminar possible. I wish you all an engaging and thought-provoking seminar. Sheshe. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Prof. Yodi, for the opening remarks. And the next one, we will also hear the opening remarks from Professor Hai Jun Wang as the Vice Dean of School of Public Health, Peking University. Okay. Professor Hai Jun Wang, the time is yours.
Distinguished Dean Yudi Mahathir Hatta, professors from Jada Mada, and participants attending today's seminar. Apakaba. Good morning. Morning. And it's our great honor to be here. This is the first time for our School of Public Health in Peking University to visit your university. As the Dean mentioned, we know your university is the best in Indonesia, and we think it's very good if we can have collaboration in the future. So we contact with Dean, and we are very grateful to get the response and timely, and we are very happy to be here to go with you to this special seminar. So thanks again. And next, I would like to introduce our two professors, and one from Department of Global Health, one from Institute of Child and Adolescent Health. And we would be very happy to have their presentation on behalf of our school to let you know some of our research. And I think it's very important for enhance the understanding each other from the beginning, but it's just a little of our school, but I think it will be good beginning for us. And today I saw some students to come in here. I would like to say our collaboration is not only for research. I think it's also important for young people, for education, for the next generation. So we always think hope is among young people. So I think we have the responsibility in the universities to encourage young people to go into this field, to join the future research and the practice in public health. So I would like to do more for the joint education. We could collaborate in this field and share the experience in education from our two universities, and we can give the students more vision about the world, not just maybe not just China and Indonesia, but also our Asian region and the world. So that's why we would like to promote global health. So finally, I still want to send the regards from the dean of our school, and also from our Peking University Health Center, and welcome you, not only professors, but maybe also students, to come to our university next year or the coming soon future. I really welcome in Beijing. And at the last, I would encourage the participants to have more discussion during the seminar or after the seminar, and we can not just learn something, but also can learn by communication and exchange the idea. So thank you so much. Terima kasih. Okay, thank you.
Thank you, professors. And we believe that every participant here are excited to hear and learn a lot from Peking University today. So we will move to the lecture session. And for the session, we will have Bapak Bayu Satria Wiratama as our moderator. He is the lecturer from Department of Biostatistics, Epidemiology, and Population Health. For this session, we will hand it over to Pak Bayu. Yeah, Pak Bayu, the time is yours.
Yes, thank you Mbak Kiki. Good morning everyone. Assalamualaikum warahmatullahi wabarakatuh, and welcome to our guests from the Peking University. So today we will have our guest lecture about innovative approach in global health regarding integrating research, policy, and technology to address public health challenges. So we will have 3 speakers, 2 from the Peking University and 1 from our Gadjah Mada University. So as you can see that there will be the first one. I will invite Professor Yang Mu Huang from School of Public Health, Peking University. She will give her presentation about improving health equity in China and beyond, the nutrition intervention in China. The time is yours.
Thank you so much for having me here, and it's a great honor to be here and introduce our research in China. So actually, I made this slides especially for you last night, because I learned, working very hard. Yes, because I learned from your dean and also from our colleague that nutrition is one of the main challenges. So I made the fresh new slides for you to introduce a concrete understanding of what have China done related to nutrition, and providing one of the case studies that we have done for UNICEF and China's government on the nutrition package program for the young adolescents. So first of all, I like to, can I control my own? That'll be easier. Yeah, sorry. All right. So first of all, I'm sure you all standing here as a students or professor from School of Public Health will agree that eliminating malnutrition is necessary and one of the very important elements that are for us to achieving SDG. So from this figure, I'm sure you all see that around the world, we have still a very important or very dramatic challenges for reducing stunting, and also for many of the triple or double burden of diseases or malnutrition, including undernutrition and overnutrition. But for China, during the past few decades, undernutrition is still a very big challenge. But now with a lot of improvement for science and everything, overnutrition is becoming a very big challenge. For example, our dean sitting here, Professor Haijun Wang, was also a very expert for adolescent and child overnutrition, obesity. So maybe later on we could have more discussion on that. But today I would like to focus more on undernutrition. So we try to summarize a picture that's showing you all the nutrition sensitive and nutrition specific interventions that have been done in China. You can see, of course, all the nutrition interventions are doing the whole life course. That means not only the maternal child health, but also adolescent, adult, and the older population. And as we mentioned about nutrition specific intervention includes more intervention that is specifically targeted to nutrition or undernutrition. For example, we have the breastfeeding, we have micronutrient supplements, we have school feeding that we discussed yesterday, and also many of the others like food fortification, where for the nutrition sensitive intervention, that means the interventions might have some relevant to nutrition, such as agriculture, market regulation, water and sanitation, woman empowerment, child education, etc. So all these, we're trying to build a close relationship with nutrition and try to combine together multi-sector collaboration from different levels that can actually improve the nutrition status in the whole population. So now I move fastly to this case study I would like to share with you. So this is a micronutrient supplement program in China, but before that you can see that the first 10,000 days is very important for the kids or for the offspring. And in the world, there's a lot of micronutrient powder programs. So from this you can see that most of them are only powders with micronutrient. And we have done some landscaping and also some meta-analysis trying to summarize all the MNP programs around the world. And now more than 56 countries have done similar programs. And every country have their own challenges. So we try to use implementarian science strategy or the framework to summarize what are the main challenges that be happening for different countries if we want to implement a national nutrition programs. And you can see there's a lot of challenges around, but after all the comparison, I think I have a little confidence to show you our Chinese sample, because I think we try to accomplish all these challenges of course, after 10 years of achievement, but I think it will be very interesting to show you. So about China's YYP program, it's called 营养包. 营养包 means nutrition package in Chinese. So what is it? So it's a nutrition package. Now you're all having nutrition package like food, right? So it's soy-based fortified micronutrient powder. So one difference about this is that in China we not only provide micronutrient, but also the soil based fortificate. So that means it provides proteins to it. So someone might say, why not milk powder but salt powder? That is because salt is also very popular. You know, the beans is very popular in China, and it's less likely to have some allergic, because a lot of might be allergic to milk. And also it's very cost effective, and also it can provide the protein that is needed. So from all this discussion from the Chinese researchers, from China CDC and including our university, we decided to have the soil-based fortified micronutrient powder. So this powder is provided to infant and young kids before 23 months, from 6 to 23 months. And you can see it looks like this. So you can actually, for some families, they can replace one of the fortified or one of the complementary food for one meal. So it's easier for the kids to have, and it's also very tasty. So next time I might bring some for you to test as well. So this is a figure that we try to summarize the development of the whole history of YYB. So actually it started in the 1990s. So it's a very long time ago. And that time it's only a research project from our universities and CDCs. So I think this also provides us confidence that if we do our research right, we provide enough evidence, and then it can become a national strategy, and it can benefit not only China, but maybe a lot of different countries as well. So you can see at the very beginning, it's only a few studies in a few countries. Later on, we scale up a little bit from one county to one province, and then to several provinces. So why it become a very big national program? It's because that time, in 2008, there's a very big event, the disaster called the Wenchuan earthquake. I know that in your university, the disaster management is also very key. But that time, when we are having the Wenchuan earthquake, our University of China CDC, we all went there to help with some of the, supporting. And then one of the researchers that is already doing the YYB program found that a lot of kids that during the disaster, they are malnourished. So they said, why don't we provide the YYB to those people or to those kids that is now not having enough food or nutritious food? So at that time, the Wenchuan earthquake hurt a lot of different places. So that is the very first time we show the country that is effective, and we can actually provide all the nutrition package within a very short time for more than 10,000 kids for maybe 1 or 3 days. So it's very effective. And later on, we can see that we also have some national guidelines to make sure that this nutrition package can be very safe and the quality assured. And later on, you can see from 2012, it became a national program. And now, till now, I think more than 1,000 counties and more than 10,000 infants have benefit from all programs. And also the funding, of course, is very important. So now not only the national level provide the funding, but also because of the very good benefits, the provincial, the local also provided some match fundings to make sure that it can be better implemented and even provided to more adolescents. Or I'm sorry, for more child and infant. So this is actually a management and implementation of this national YYB program. You know, China is a very, very big country, and this national program is provided to 22 different provinces. So how can we make sure that every kid can actually get this delivery of this package and they can take it every day? So you can see from the very top, there's a national program office, and within the province and county, the village, every level, we have our own office to do the management. But also we collaborate very closely with maternal child centers that is providing all those, buddy tests and all those health educations, along with many other researchers and scholars from different universities. So this is the main body of the program management. And also you can see from the flow chart, we also include peers, that is the companies that is producing the YYB working with us for delivery. And sometimes they can also provide health education through online platforms and when they are doing their advocacy. So you can, to summarize, it's led by the government and implemented through the 3-tier health systems. So I think health system strengthening is super important. It's multi-sector collaboration supporting bidding, procurement, and program implementation. And also it's a multi-layer technical support, ensure that program monitoring and quality control is assured by the China national CDC and different level CDCs. And also private sector partners were engaged along the way. So then we try to do the monitoring of the national program. We know that we have to prove that this program is very effective and also have a lot of benefits. So you can see we have effect monitoring and we have quality monitoring that is provided by mostly by China CDC. So that is provide, for every year we try to choose we try to sample like around 40,000 kids that we can monitor, their health effects. And also we do quality monitoring for every nutrition package to make sure that it's quality assured. So for our research team, after about 10 years, in 2011 or 2021, UNICEF and the Chinese government said, why don't we try to summarize this whole program and try to evaluate it? So we, along with a lot of professors from social medicine, from health economics, and we try to summarize everything from these programs. I think this is very interesting. So first of all, we try to evaluate the health outcomes, the health benefits. You can see no matter the anemia, the stunting, the underweight, or the prevalence of fever and diarrhea all decreased tremendously during the process. And also, we try to do, different studies, which means sometimes people will see, all those changes happened in this along the way, might not only because of the nutrition package, it's because of the improvement of, economics, education, health, poverty elevation. So we try to use other database to compare, now the counties that having YYB are all the poverty-stricken counties. Then we try to use all the other data to match counties with YYB, the Yin Yang Bao, and the county without the package. And then after the comparison, we can still see a slightly different. That is, for example, the under 5 mortality rate in the YYB counties is decreased more notably, and also the infant mortality rate is also declined remotely. And then we did cost-effective analysis. I mean, for the government officials, they always want to know what invest and that can take in return. So we did the calculate cost-benefit ratio for anemia, of course, because anemia is much easier to evaluate. It's more than 1 to 7. That means if you put $1 and then you can have even 7 in return. So this is the big number that can actually support the program to go along. And also, surprisingly, we have collaborated with some of the social science research from the main campus of Peking University, the very top scientists, and we try to evaluate the social effects of the program. And we surprisingly see a lot of benefits that we haven't realized. For example, the social effects for families, now they have a lot of feeding knowledge because we provide health education while we provide the nutrition package. And then it actually improved all the nutrition related knowledges for the mothers or the caregivers that will have a long time lasting benefits, because the nutrition package will only being provided to the kids before they're 23 months. And later on, it's more about food, it's about feeding, and these education is very important. And also we can see there's a social effect on health systems, because it helps improve the overall systems. It helps improve the health management of the children and enrich the primary health services. For example, sometimes because the parents want to have the nutrition package, they have to monthly come to the primary health care center, and then the kids will have the health evaluation. And if they have other situations, they can consult the the grassroots health workers at that time. So they can have a very strong collaboration. A strong relationship with and very trust their village doctors. And also you can see there's a social effect on poverty elevation and emergency response, which I elaborate a little bit in the past. So if we want to try to summarize the key experiences from our program, I think there are a few that could be shared. The first of all, I think the program is based on evidence-based scientific research. I think it's super important. I know now we're having several national nutrition programs going on. So it's very important to start from the scratch to do a very concrete research design, maybe have the baseline and maybe to follow up. Even though it's just a small pilot study, I think it's also important to at least have some data that can support a more scientific result. And also the second, the program has received financial support from central government with additional match funding from provincial governments. So I think funding is very important, but sometimes we cannot only rely on the central government if it's a big, huge amount of money. We have to try to fund match funding not only from local government, but also maybe from enterprises or maybe other, philanthropies, any people or actors that can actually have the same goal and want to work together. And the third, the harness of the three-tier network from the country to the county, the town, the village, health strengthening can be improved during the process. And it's, I think it's like a circle that can support each other. And the fourth, coordination between public and private sectors to guarantee the product supply and quality is very important. Sometimes the government might be reluctant to be closely collaborated with private sectors, but if we have a good mechanisms to make sure that it can be collaborated under good guidance or surveillance, it can still provide a lot of help for the government with the private sectors. And also the capacity building and dedication of community level workers. So, during all those programs, we provided a lot of health education and not only health educations to the caregivers, but also a lot of capacity building on trainings to village doctors and different levels, not only on nutrition, but also how to do program management, how to do health systems strengthening. And I think it's very important. So this program have advanced, benefits. And also a solid advocacy and social mobilization is very important. So you can see a lot of different mobilization strategies for this national program to make sure that every kid can actually eat this nutrition package, and every day the parents will provide them and they trust them. So that's all for the nutrition package. And then I know that we're going to have a school feeding program very soon. So you can see this, China actually at the end of 2011, we started the school feeding programs, and it's the county offers about 4 yuan subsidy for each meal. I think it's very similar to Indonesia. And as of 2020, the central government has allocated 159 billion yuan for this plan to the benefit of 23 million students in compulsory education, that is the elementary education. And also we try to evaluate the health benefits, and you can see the average height of boy and girl students in different years old household group increased notably from 2012 to 2016. From here, you can see all the small figures. So we have to say that the school feeding programs is also a very important programs for the kids. So how to allocate, the very limited funding to, whether to the school kids or to the adolescents, through the infants, I think there is something that we all have to study more and to provide or consultations to the government. But from China, I think it's very important that we only target to not every students, but only the ones that is needed. For example, the nutrition package, the YYB program is only provided to the poverty-stricken counties. And for the school kid, this is also provided to some provinces, not everyone, every place. And so maybe if I have a little bit more time, I can't. Sorry, I did something wrong. So lastly, I would like to share with you one of the publications we have just published in the BMJ. I think this provides you even more concrete results of why we think YYB is very important. So this is actually used with the data that is collected each year by the monitoring data. So overall, we have 210,000 patients, participants, the young infants, and then we try to evaluate all the prevalence of anemia, stunting, wasting, overweight in children. And you can see that from 2016, because that time we have a better outcome, surveillance systems. The prevalence of anemia is 18%. It's already declining. The stunting is 7.5, wasting 4.7, and overweight 3.1%. So, and also we found it very interesting, the prevalence of any two existing malnutrition form is very low, which means if it's undernutrition, it's undernutrition. It's not like for one person it's obese, but at the same time they have micronutrient deficiency. And also we can see that all four forms of malnutrition decreased from 2016 to 2021. For example, anemia decreased by more than half, from 18% in 2016 to 8% in 2021. And for stunting, it reduced over a third, from 4% in 4% in 2021. So the annual decreasing rate is about 10%. But the SDG, or the World Health Organization's target, is that you can decrease annually by 3.9%. So that means we decreased much faster, and you can see the stunting rate is already very low. So that means with a very concrete implementation strategy, it can be cost effective, and every country can really achieve this WHO, the SDG goals. So you can now see each form of malnutrition in China was near or even lower than that of the best performing countries globally, like Singapore or Japan. So you can see all these data are only from the lowest or the poverty-stricken areas, so the kids that was the worst nutrition status. So I think we provide confidence to the world that if we do it right, we can do it good. And also we can see some other findings. For example, the growth differences related to education persist. So women empowerment, girl education is important in any circumstances. And also, I think there are several considerations that from our research, I think could also be inspiring for other countries. For example, we see that gaps for greater. The first two things I have already mentioned, but the third, the inequalities related to education seems to occur before 6 months of age, and these gaps did not widen by the age of 2 years. So that means the greater attention should be directed towards mothers and interventions in the full maternal and child health care continuums, which means for pregnancy, we start to have to think about nutrition interventions, and you should continue from the pregnancy till the after adolescent. So I think that is all I want to share with you. I'm sorry it's very fast, but there's so many things I want to share. So maybe later on, if you have any questions, we could have more discussions. Thank you very much.
Thank you, Professor Yang Moo Huang, for the great insight about nutritional intervention in China. Next, we will have our second guest lecture from Professor Yisong, with the titles of the presentation is about national adolescent surveillance, priority indicators, and current data gaps. The time is yours, around 20 minutes.
Thank you. And you know, it's the first time I be here, and also the great honor to be invited by professors here. And also, I want to show my very gratitude to our dean, Professor Haijun Wang and Yang Mu Huang. They show us a chance to provide such an overall picture of our own Institute of Child and Adolescent Health. You know, I never think that we have some linkage with your university. Till last night, I met with Professor Burgos, and I know that we actually have some relationship with his team, and we do some tobacco control, both in Indonesia and also in China under the UK leadership. So that's the reason I think WAL is fortunately to have such a presentation to show what we have done in our institute. And it's a national surveillance system, but I would just like to show maybe it not only our work, maybe our future cooperation together. And I want to provide 3 questions before my speech. The first one, why we should establish an indicator system for adolescent health. And the second, how about we know the progress of the indicator system for this field? And the third, what the challenge for establish such kind of indicator system. And I would like to say thanks to one professor from Australia, whose name is George Patton, and he passed away 2 years ago. It's very sorrow. Why I mention such kind of professor? Because he is just the first person to mention adolescent medicine in the very mainstream of the academic field in the Lancet Commission report in 2016. At that time, adolescent medicine is the formally mentioned in the very, medical area. And we see that it's also the first time for many experts to pay more attention on adolescent medicine and adolescent health. And we also want to show that why the global experts would like to pay more attention, because we found that if we don't, in other words, if we think that adolescent health is not important, we are difficult to achieve SDG goals. And also, we can also find the Chinese disease profile also shift very fast from early childhood to the adolescent. We earn or obtain less profit from such kind of rapid social development. And also we found that we should see there are very increasing unrecognized burden among this population. And so we know that evaluation is needed for promotion such kind of population. If we don't know what they are happen, and we don't know the disease burden on this population, we don't think about what can we do for them. And also, we found that in China, and also I think in Indonesia also, there are very complex situations among this population. We found that there are too many issues, health issues in such kind of fields. We found myopia, infectious disease, malnutrition, and also injuries, obesity, and other problems that very multiple burden for this population. And we thought that single indicator is not enough to evaluate such kind of population. And also we can find that it has long time to be neglected, but really an important period. And I know that most of people here in this room maybe just in the period of adolescence, because we know that the new adolescent terms is beyond its old time. We define it from 10 years old to 24. So I don't know, but I think some people here should be in such kind of age period. And so the health problems faced by this population are very different from adults and also young children. So an indicator system for adolescent health very necessary. And the other things we could say that we can found for a country and for all population, the sources is very limited, you know. So we should also focus on those priority problems. They should be and they can be solved, right? And that reason means that we should identify which is the burden of disease and which one has very huge profit for the future, and what is the policy concerns, and which means indicator system means not all indicators. They need to be focused. So the answer for the first question, why should we establish such kind of indicator system, is because of the, how to say, it's complex, it's inappropriate, its specificity and the limited resources. And also we want to say how the other countries, other peoples do for this work. And we found that not only countries in USA or Japan or WHO, all those countries, they have their own indicator system, but they have similar framework to do that. What's it? It's not include education, but also social determinants for health. That's the reason we think maybe we can adopt a framework from WHO. So if we talk about health, we could not only talk about health. So we think maybe we could start from health knowledge and outcome, and to the knowledge, and to the service, and to the whole environmental and policies. That's the reason when we do this work, we step by step, and first we search from the international guidelines and recommendations and documents, and to identify which kind of framework could work for our country. And also, we would like to screen some principles to let every expert participate know and have the consensus. And also, step 2, we collect specific indicators to know which one is important and which one should be in the very top ranks. And the third step, we screen core indicators and the potential one to improve and revise the indicator system. So you can find that 5 domains in our indicators, and the very important is the health outcomes, and also Yang Mu mentioned under nutrition. We also have others very important indicators like anemia and overweight and injuries, myopia, such like that. I can share that we just published it, so we have like publications to share. And other for that, we also found that there are some challenge we faced. This challenge is that even we draw such a big picture to draw everything, and we would like to have some very important indicators. There are still two important ones without national service to reflect. For example, the social media use, and also some addictions. You can find that we also have some indicators just conducting in the specific ages. For example, the dental health. For example, the anemia surveillance. And also we found that even we have a very big picture of the surveillance, we still have some from school-based survey and the others from household survey. We cannot combine them together. So that means in some survey, we have just student data, and for some others, we have only community data. So all the future suggestions for our study, we think that we should still need to improve and promote the adolescent indicator system. And also from that kind of work, we can know what we have now. And it's better, it's fortunately that our institute has such kind of responsibility to hold the national system surveillance, for student common diseases and also risk factors, so that we can have many indicators in such kind of monitor surveillance in such kind of system, indicator system. And also we want to develop adolescent health promotion strategies according to based on our monitoring system. And also we would like to incorporate adolescent health into national strategies, because that we just one period and we not covered all age span of the population. And more, we should also do something which is a priority one. So we just published a series in the Lancet Public just last month to know what is the obesity burden here, and what is the determinants, and what the strategy we can do in China. And we would also like to share that kind of examples, and also how to publish such kind of series to, if you have such interest. And also we have some indicator system publications in the Journal of Adolescent Health, and I would like to share. And also I think it's all my slides, and if you have any questions, we can discuss more. And thanks for your listening. Thanks.
Yes, thank you, Dr. Yisung, for the presentation. Okay. We move to the last presentation before we go to the question and answer session. It will be from the Universitas Gadjah Mada, Dr. Riris Andono Ahmad, that will present about Wolbachia as innovative intervention for dengue controls in Indonesia.
Good morning, everyone. Distinguished guests, thank you very much for the time that be given to me. And for the students, some of you already hear this several times, so I will update something, but this is the study that we did and still do in our university, and it's about introduction of a new technology for dengue control using naturally bacteria called Wolbachia. So dengue is one of the fastest growing re-emerging disease. WHO estimated that the annual infection can be as high as 300 million per year. But then it's because it's like a COVID, 75% of the infection are asymptomatic. So the cases is not as high as that, but still we have millions of cases per year. And as you can see that Indonesia, along with South America and Latin America, are the countries with the highest burden. And if we go the latest figures in 2024, and this year is one of the largest dengue outbreak globally, we can see that up to April 30, globally there are 7.6 million cases confirmed. So most probably the real cases are higher than that. And we have the more than 3,000 deaths globally. So somewhat it's comparable with COVID because it's the high transmission and also the death. And in Indonesia, dengue is also one of the public health priorities. Globally, it's considered a neglected infectious disease, but now it's become more on the priority agenda. In Indonesia, this is one of the largest prevalence disease nationally. So and we can see that here it's always mostly more than 100,000 cases. And this is for dengue hemorrhagic fever because there are several clinically appearance. There is a dengue hemorrhagic fever, which is the severe one, but there is also dengue fever. So this is on top of the iceberg. And regarding Wolbachia itself, this is a natural bacteria. It lives in insect cells, and it can be found in more than 50% of insect in the nature. And it's safe for humans, animal, and environment. So it's what we call symbiont. It's live naturally. It doesn't affect anything rather than how the insect reproduce. I will show you. And Wolbachia is not a genetically modified organism. The way we introduce Wolbachia, because it's found in 50% of the insect. Unfortunately, it's not found in Aedes aegypti, which is transmitting dengue, but it's found in Aedes albopictus. And this is how, the scientists from Australia, from Monash University, how they introduced the bacteria into the eggs of the mosquito. You can see this is the needle. It's somewhat inject the bacteria into the cell, and it become within the mosquito. And the characteristic of Wolbachia is that it changed the way the mosquito reproduce, whereby if a male mosquito with Wolbachia mate with a female mosquito without Wolbachia, the eggs will not hatch, so it can be as a population control. If the female has a Wolbachia and the male, if the female has Wolbachia and the male not, or both, then the Wolbachia will be transmitted vertically into the next generation. So if this type of mosquito mates, then it will reproduce a new mosquito with Wolbachia, and later on it can establish in the population. So there are two ways to use the Wolbachia, and sorry, before this, it is found that the Wolbachia in the mosquito will block the virus replication in the mosquito's bodies, so that it lost the vector capacity to transmit the virus. So that's why there are two ways to use the technology to prevent dengue. One way is to suppress the mosquito population by introducing the male mosquito to mate with the female mosquito in the population, so that we release the male mosquito, they mate, and somewhat then it will reduce the mosquito population. The catch is we have to release it continuously to have the effects of population reduction. The second strategy is to replace the mosquito population with Wolbachia mosquito. Here we release usually both males and females, so that the females can mate with the males mosquito in the population, or mates between those with Wolbachia, and we release gradually and we stop. So this is the release period, and stop, and it can establish itself. So in some countries they prefer this strategy, like in Singapore, because they have a regulation that they cannot release a factor that can transmit disease. In Indonesia, we use this strategy. And how we do that, as I mentioned, that we release gradually over 6-month period until usually on average it reach the threshold level of 60%. When we have this 60% threshold, then we can sure that it will grow and replace the mosquito population, and it takes 6 months because it's required around 12 rounds of mosquito release. So that's how we did it, and we already did this is what already we did in Yogyakarta province. You can see here, this is Yogyakarta, and we already have released in 3 cities, in the Yogyakarta cities, in Sleman, and in Bantul. This is one epidemiological ecological area for dengue, and it's covered 1.8 million people, and we did several studies. One is the quasi-experiment study. This is the release area for quasi-experiments, and also the cluster randomized control trial in 2017 and 2020, and this is the area. And later on, we filled the Yogyakarta untreated area. So now all these 3 districts are covered with Wolbachia. And just to give you the result of the cluster randomized control trial, this is the area of the trial. It was divided into 24 clusters, 12 randomly selected as intervention area, and 12 as control area. And over the 2 years period, we found 318 dengue cases in untreated areas compared to the 67 dengue cases in a treated area, with 100 cases hospitalized compared to the 13 cases hospitalized in the treated area. So it corresponds to 77% reduction in dengue cases, and also 86% reduction in hospitalization. And this is somewhat very significant if we compare with others method currently available. And if we see the spatial distribution of the cases, you see here, this is, it's not that clear. This is the area of the control and intervention. In the control area, we can see that the cases are higher compared with the intervention area, and there is a hotspot in the control area in terms of transmission. So this really shows that especially it covers and also protect the one with the Wolbachia intervention. And if we compare with the latest technology, which are vaccine, there are 2 vaccines now currently available in the market, which is Takeda and Sanofi. The Wolbachia is comparable with Takeda for all the virologically confirmed disease, dengue. And it's also comparable for different type of serotype for dengue viruses. So it's also, you see, if we talk about the confidence band, it's somewhat not crossing this line. So it's really significant. And if we talk about the real impact in Yogyakarta city, this is we have this from surveillance data, and we track back from 10 years before the intervention, from 2006. We can see here that the pattern of dengue cases are very fluctuated heavily. And when we start to release in half part of the cities, we can see that though it's still fluctuated, it's not as, the amplitude is not as fluctuative as before the intervention. And this is where we release in all the city. We already also see though there's still peaks, it's much lower. And if we see from 2018 to 2023, the fluctuation is somewhat much smaller. And if we look into the reported cases, this is where we start the release, and this is where we release in all cities. Now the cases reported are comparable to the 90s. So it's really have a real world impact in Yogyakarta cities. And it's also not only in the cases, but how we control dengue, because it's also affect how the municipality did the insecticide use for fogging. You can see here that this is before the intervention. If we compare the intervention area and a control area, they are comparable in a way they do the fogging. But after the intervention, we can see that in the intervention area, the insecticide use is much lower. Even in 2023, the municipality health office reported that they only use 20% of the budget for fogging, so that they reallocate the 80% of the budget to other disease control for TB. So that's another impact for this intervention. And it's not only in Indonesia. This is the other evidence from different countries. This is from Colombia. We can see that there are in the below there are reported 95% reduction. In Medellin, also 95% reduction, and in Itagüí, it's also 97% reduction. And they also did a comparison within the national prevalence in different cities. in Colombia, this is the variation between the prevalence of years, and we can see this is before the intervention, and this is the after the intervention. In 4 cities, the 3 cities, they see the reduction trend compared to the different cities in the Colombia. So there are also reports from different cities in different countries, and the result somewhat varied, but it still have a significant impact on dengue reduction. And there is a study from Niterói, which also include chikungunya and Zika, and they reported that the Wolbachia mosquito can reduce the chikungunya cases up to 56% and Zika cases up to 37%. So it's not only affecting dengue, but also Zika and chikungunya, and also it can affect yellow fever if there is any virus circulating. So from the studies, then the WHO FICAC made a recommendation that there is evidence of public health impact against dengue, so that they recommend WHO to start initiate guidelines development process, and we need to move through more on what you call implementation phase from the research phase. So with that, then the Ministry of Health in Indonesia, starting from 2023, they tried to have a pilot implementation, because this is very new innovation, and the way we do the intervention is never been tested in the programmatic setting. It's different than other intervention, because this is only one-time intervention, and it requires a huge resources in terms of funding, in terms of human resources, so that we need to test how it can be integrated into dengue control. And from these 5 cities, this is the where it is: Semarang, Bontang, Bandung, West Jakarta, and Kupang. It covers this size of population. When I see this and I compare to China, this is very, very small, because I try to see what is the smallest cities in China. I think there's a one from Fujian, but still the population is around 3 million. So cities, this is biggest cities in Central Java. This is in Jakarta. It still have very small compared to the China, but this is where the dengue cases more happens. So this is where we try to see whether it has impact in programmatic setting. So what next? We try to see, after the implementation of 5 cities, we see whether we can have a good implementation outcome if we do it within a programmatic context. We need to also assess the effectiveness of the intervention, and also the scalability of the intervention to Indonesian setting, because the Ministry of Health, they have a huge ambition. They want to have this intervention in 200 cities in Indonesia, with 25 cities within the 5 years. So this is something really new. Really, we need to learn how to scale this intervention, and there's a lot of things to study and to share later on. So I would like to thank these 3 organizations, which Tahia Foundation, who provided grants for the studies, This is our partners and collaborators from Monash University and also the Ministry of Health for taking up this intervention into their program. Thank you, and I give back the time to Pak Bayu.
Yes. Thank you for the presentation, Pak Doni. And then we will move on to the questions and answer discussion section. And before that, I will invite Dr. Huang and Dr. Song to take a seat in front of this chair. And then we will open the floors for question. Maybe start from 2 questions. Okay. One from the left side and then the right side. Anyone want to ask? Okay, maybe one question first. Please mention your names and then there's a question. Maybe you can stand up. Yeah, Didi.
Okay, thank you for the opportunity. My name is Lisiana Wahyudintias. I'm from Public Health Nutrition. I want to ask to Prof. Yang Mu Huang. From your presentation, we know that the innovation of YYB program is excellent because the prevalence of stunting and underweight decreased by 45% and 28% from 2012 to 2020. So my question is, how long this program will be implemented, and are there any obstacles related to the implementation of that program? Thank you.
Thank you very much for the question. Should I stand as
Yes,
well? Yes. Thank you. So actually, I think this is a very good question. So questions that we've been asking ourselves for a long time. So first, to the first question, how long it will happen as well? We are hoping it could happen as long as possible because malnutrition continues to be still a very big challenge, especially macronutrient deficiency. But now China is over poverty alleviation series, sections, and the government is thinking maybe we should stop this program to move on to maybe feeding programs, because we cannot the interventions cannot last forever. So this is something. The reason why we do this program, the evaluation program, is try to show them it's still cost effective, it's easily implemented, and you have more social benefits than only the health benefits. So we provided all these documents not to the world but also to the governments. So I think they're still within the discussion, but at least before SDG ends, I think they will continue. But I'm not sure about the next level, because now we're also thinking about food fortification. We're thinking about parenting education. So there's many things that can combine together. So let's see how it happens. But from my point of view, I think it's better that we can combine a lot of different interventions together, so it could be more cost effective, but at the same time can conquer these challenges. Yeah. So this is the first question. The second question about the obstacles. I think there's a lot of different obstacles along the way, because this is a more than 10, even 15 years programs growing from the very beginning. So I think at the very first stage, the initial stage, the obstacles are trying to persuade, let everyone understand this is a very important program. We should continue fund them from local government as well, but also for the caregivers, for the parents to know that it's beneficial for your kids. So you have to apply. You have to let them eat every day. So you can see the adherent rate for this program is very, very high. It's more than 98%. So that means it's because every village doctor will go to even go to the house to help them, to provide health education if they feel that they don't obey to this everyday routine intakes. So this is at the very first stage. It's to let them understand the importance and help them to to follow the programs. But for now, I think there are several other obstacles I think we have to think about. I think this might be also an obstacle for you in the future. For example, within this program, very surprisingly, there's 6 different companies that build up with these programs, which means these companies provide very cost-effective, very cheap but quality-assured nutrition package to the all the kids, and then they help do the delivery, they do everything. But then at first it's only one company, then it's 2, 3, 4, 5, and then we have to do the procurement. So that means, each province, they have to choose, what company or what, because they're providing all the same products. So then you have to say that which company I buy. So we have a national guidelines to see, but all they can do, everyone can do the same thing. Then they decrease the price. That becomes the situation, because when they decrease the price, then the companies sometimes, the quality is still assured, but the health education and many other services come along. If they reduce the price, they have to reduce the services, or sometimes they do it without earning any money. So it cannot be sustainable. So many of the companies said, if we continue to do it like this, then we're going to drop out. So this is going to be a very big challenge for us now, is how to be balanced with the providers, the services within the short amount of money. So I think this is something we have to think. So I think it's very important that we collaborate with private sectors, also think from their point of view, because they're the one that is actually helping the government to do all these programs. So I think this is challenges at the moment, the most important challenge for us. Yes, thank you.
Okay, thank you for the questions. Any further questions? And then maybe any questions from the other students or from the online participant? Oh, okay, we have questions. Oh, let me read. Oh, so this is from Mas Ridwan Ansari. Okay, this is for related with the soy protein powder. How the researcher manage the quality of the product during the extraction, especially to prevent the protein heat denaturation? And then based on the experience, I think it's for Dr. Huang. Did the powder were given to all children or as a therapeutical food for certain child conditions, such as those with stunting, wasting, or others?
Okay, thank you very much for this 2 questions. I didn't have time, but now I have more time to elaborate. Thank you for bearing with me. So actually, I think there are so many amazing stories coming along with these programs. For example, at the first about the protein, the soybean, there's a lot of pattern or new innovations or technologies happening around along with the programs. So you can see a lot of new technologies were brought up by the private sectors, but they provided free to all the government and all the other companies. So they don't have a patent belong to their own. So all these questions you mentioned, we have a lot of different new technologies. For example, for some of the flavor, when you add fairing it doesn't taste good. But we use, or sometimes the calcium we add to the powder, it doesn't taste good. And then we use many other, technologies to wrap it up into this soy powder. Then it doesn't taste bad, and also it can help them to continue to be put in within even in high temperature, moisture surroundings for more than 6 months or more than 1 year without any change of flavors, or sometimes it doesn't smell good if under circumstances. So I think there's a lot of technologies that we also want to share to other countries if it's possible, because there's so many innovations coming along with this. So I think this is not the researchers and management manage it. All these are provided by the, of course, collaboration between researchers and private sectors. And these private sectors not only collaborate with nutrition researchers, most of them collaborate with food technology researchers from other universities, or they're very specific in food management or food design. As for second question, I'm sorry I didn't make it very clear. So this is not a treatment therapeutic food. This is complementary food that is provided to every kid that is in poverty-stricken area. So that means we choose these counties because these counties are the counties that is with very low income, family income. Their food diversity is very low, and the undernutrition challenge is very high. So, and also, if you see the ingredients for the macronutrients, it's only about half for the annual daily needs. So that means if you take it one day, it will not overload. It will have harms to you. And if you eat it, at least you can make sure that you will not be deficient. So that means every kid, if you eat it, there's not going to be any side effects, but it's going to be helping you grow. So this is not a therapeutic food. This is a complementary food provided to all the kids that is living to those, poverty-stricken areas. Thank you.
Okay, thank you for the answer. For Mas Ridwan, is there any further questions? Okay, and then from the online or the okay.
Thank you very much for the opportunity. My name is Federico Bosco. I am from Field Epidemiology Training Program. So I have two questions. First question for Professor Yang, and also the second question for Professor Doni. So the first question is for Professor Yang. I think if we see there are preconditions for malnutrition status in the children, as also you rightly mentioned in the presentation. So what I would like to know more for this information is about is there any disparity in the access for the program in the rural area and also in the urban area? And also the second question is about what is the precondition for malnutrition in children is also related to the mother status. How do you address that in Chinese practice? This is the question for Professor. And please, I would like to also to continue the second question. For Professor Doni, I think Professor Doni already presented about the Singapore, why they choose the first method, and in Yogyakarta, we choose the second method. Based on what, why we choose the second method, and also in the Singapore, why they choose the first method. Thank you very much.
Oh, the disparity. Sorry, I was so focused on your question too, Professor. So the first question about the disparity for access to, yes. So actually, I think this is the reason why I emphasize on health system strengthening. So because in China we have village doctors even in the very remote areas, and we have 3 tiers. So from the provincial to the counties and to the villages, there are several levels that can assure that even in the very remote areas, because the system already assures there's village doctors in the remote areas, and they will be included in this overall process. So fortunately, there's not a disparity, but there's many challenges for those areas. So what happens? The private sectors really help a lot. For example, they will send directly, use their vans or their cars to the village doctors, to the village. Sometimes if it's too remote, or sometimes the village doctor will cross a lot of, cross the mountains to get the package from the county level, but still it's very difficult for them to bring back everything. So it really needs a lot of support from private sectors and from other things. But also in China, there's many companies that is providing deliveries, and sometimes they can also help with the process if it's very remote. Sometimes, because in some very remote areas, another challenge about the delivery is that even if the kids stay in the village, it's okay. But if the kids move to another county with their parents if their parents work out from home. So we still make sure that we provide the package to them. How do we do that? We will mail them to their family with their new address. That means that no one will left behind within all those areas. I think we even have some small movies that is filming with that. I think it's very, very interesting. Hope in the future we could share with you. And so the second question is about the the malnutrition for mothers, right? So I think it's a very good question. So because for those areas, I'm sure the families also have undernutrition programs, and I mean problems. This program is only designed for 6 to 23 years old, 26 months, 23 months kids, but you know all these kids are living in poverty-stricken areas, and these areas we have a national poverty elevation program, which means we provide many other interventions at the same times, including such as health educations, like economic support, education elevations, women empowerment, many others. And all these, I think, still can benefit to the mothers. And at the same time, at least these mothers will take their kids to the clinics, to the village doctors, and they will have the health education about nutrition. So if they themselves also have a nutrition situation, the village doctor will also provide the some consultations, or even provide some of the treatment if they're undernourishment. So I don't think we witnessed, at least for these mothers, a very big challenge of undernutrition. But still, I think this is a combination of many different interventions together to show this improvement. Yes.
Thank you very much. Okay. The real reason is I don't know, because I cannot represent Singapore government, but I think there are 3 reasons. One is this is something that in their environmental agency website, it's because of regulation. The regulation stated that they cannot release factor carrying mosquito, factor that can carry disease in the environment. The second is the size. Singapore is very small, limited, and it's though it's the mobility is very high, it's still an island country, so it's manageable. And the third is the resources. I mean, Singapore is one of the wealthiest countries in the world. So with that, it's really okay, affordable to have the first method. But if it is in Indonesia with 200 cities, and if we and it's an open population, because the mobility is very high. And if we select the first strategy, which is a suppression strategy, it requires continuously what you call intervention. With each intervention, cost the same if we choose the second strategy, because we need to release in a wide area, which costs the same. If we choose only male and both females and males, but the effect is long lasting if we select the second strategy, the replacement strategy. So I think that's in investment perspective, it's more cost effective, especially for Indonesia, with very limited resources, to select the second strategy.
Thank you. Let's give applause to Pak Doni and Dr. Wang. Any further questions? Oh, it's enough. Okay. Okay. Next one from this side. Oh, we have 2 questions. Okay. So after these 2, then from the left side. Please state your name and then your questions.
Okay, Bismillah. Thanks to the opportunity. Okay, my name is Reski Nur Fatmi. I'm from Department of Public Health Nutrition. I think I want us to Prof. Yang Mo because about is the program Yin Yang Bao. This program is similar to one of the program in Indonesia, namely Taburia. So I wanna ask to how long does it take to see change in the improvement of children's nutritional status? And the second question is, what is the background? Why is only focus on infants age 6 until 24 months, or is just is a priority? And the last question is, what is the output and outcome from the nutrition improvement program for students in rural? Thank you.
Sorry, so the first question is about how long it takes to be effective. Yes, so at least, I mean, for anemia, it's easier to see early, about 3 months, we can see a decline in anemia, but usually this evaluation happens, for example, if the kids is from 6 months to 1 year, we do monthly, surveillance or evaluation with the village doctors. So we can see slow improvement by many others, but I'm not sure you mean by statics or by person, because I want to show you a very interesting story. At the very beginning, the kids' mothers don't think it's a very good intervention because they don't know what is it and how we can see it. Then the village doctor itself also, in some rural areas, they also have their grandsons or their kids, so they ask their kids to eat the YYB at first, and then they see that they see their kids maybe within like 1 week or 2 weeks, they started to have like better appealings. They feels like they look like more reddish or feel very nice. And later on, they found that their kids don't go to hospitals very often. So that means the anemia rate and the fever rate is also declining. So I think the effects, if we see it statically, maybe 3 months or half year, but from each person, sometimes within a very short time, you already can see some differences happening. And it's very consuming for many others. And as for the second question, so why is from 6 months to 23 a month? I think, first of all, because I think breastfeeding is still one of the priority interventions for around the world. So we addict to that. So before 6 months, it's conclusive breastfeeding with no complementary food. So we started from 6 months. That is the reason. And why to 33 months? It's the 1,000 days, and also because usually we think after 2 years old they should have a good feeding. I mean, they can eat everything, so they don't need complementary food. So we designed this nutrition package as complementary food, which for the kids that cannot eat everything, that can have all the nutrients from the food. So we provide this as additional nutritional supplements or complementary food. But at the same time, we provide health education. The reason why we provide a health education is because we hope after the program stops, the education can still pass along with the parents, and the kids can still eat nutritiously after the nutrition package. But another very interesting story is that because it is so many good effects happening, the mothers in many places said, why can't you provide us another year, before 3 years old, can we have additional ones? And sometimes in other counties, maybe they're close, but they're not poverty-stricken counties. They said, why can we not have the nutrition package? We also want it. So that it comes the matching funding from the province. The national funding already covered all the kids for poverty-stricken counties. But for some local match fundings, they can increase from 2 years to 3 years old. Sometimes it expound to more counties. So that is the reason why I think it's very important to show the effects, and then people will start to hope to widen to. So to your question is 6 to 23 months, and then maybe, but beyond, it can also work. And even for myself, sometimes if I feel sick, I will also eat the nutrition package to be healthy and to be immunized better. And then for the third question, sorry, I forgot. Do you have a third question? 是啥来着? Oh, you mean the for the students, the feeding programs, the school feeding programs? Yeah. So this I am not sure because I didn't do the overall evaluation. I only add the slides yesterday night because I know. Yes, but at least from the open results, we can see the the height of the kids have been increased. But of course, I know there's also some follow-up on the cognitive of the kids. That means even for the YYB and for the feeding, the nutrition have long time results for cognition, for even for economic growth for the longer beings. So I think the outcome and outputs for this program is not very clear from scientifically research, because this is more of a program for a government program, not a research program. But I don't know, maybe other scholars, or maybe later on we could do some research on that. Yes, thank you.
Thank you. Please give applause. Okay, then next one from the from next side.
My name is Hendrika Yuniartin Ganis. I am from Field Epidemiology Training Program. I have question from for the Prof. Song. I have two questions. The first one is, how does nutritional surveillance addresses disparities among adolescents from different socioeconomic or geographic backgrounds? And the second one, and what are the main challenges in linking surveillance of this nutritional surveillance data to effective policy implementation? And I have question for the Prof. Yang Mu Huang. Are there culturally tailored approaches to addressing the triple burden in China's diverse regions? If so, could you provide examples of how those approaches are implemented? Thank you.
Thanks for that question. I think it's not only a public health question, also a policy questions, that for the adolescent health, we should say that for the global perspective, that we should say that we actually at least need to focus 3 domains. The first one is health outcomes, something like infectious disease, something like mobility and death, and also dailies. And for the second domain, we should focus. We also focus on the health risk factors. For undernutrition, obesity, anemia, drinking, and the tobacco use, something like that. And also for the higher level, the third domains, we should focus on the natural environment, or we call it social determinants of health, social health determinants, sorry. And yeah, I should say that with the development of social economic, that the many disease patterns and also nutrition patterns shifted, and including infectious disease. That many countries, they are facing with the how we dealing with the multiple burden to the injury access burden and to the chronic disease burden. So for that reason, we should say that external environment play a more and more important role. So that's the reason why in our framework, we also mentioned that we not only focus on the health skill, health knowledge, health outcome, we should also pay more attention to on the service and also the environment, including policy. But yes, we should, in such kind of the real world, we should face many conflicts from the economic, also geography, political conflicts. So that reason, the young generation, without their enter a hard pattern of the world, you know, it's not very easy. But I think that we should put that kind of determinant into the indicator system to do more attention for our young generation, you know. And for the second question, sorry, for the second question, is it the crime for what? Sorry? For data. Oh yeah, for the data, yeah, it's another very good question. You know, actually, even in China, we have very different data set based from the government, also some scholarship universities or China CDC. But we have, you know, we are from Peking University, but we have another name for our institute is the branch of Schoolhouse of China CDC. So that's the reason why we should handle some kind of national surveillance for data to show and to know what is the priority ones and what left behind. But we also think that the system, that kind of system, is time-lag behind of the current situation, you know, because the generation grows so fast, and when we create when we established or developed some questionnaire to evaluate to monitoring, and we found that they grow so fast, they changed, the situation changed, and they don't use, for example, in the 10 years ago, we used the questionnaire or scale to test how often do you use your smartphone, you know, one week during past 7 days. But nowadays, maybe we couldn't use that kind of indicator or question because they don't put down their smartphone, you know. So that's the reason we think that even we have such kind of data set from our institute and also from national system, we still have some challenge to be solved, you know. And I also think that some international studies to compare that kind of data set. And also I know that Indonesia has belonged to the DHS and MESH data. You also have some national ways to measure the health, the young's health. But we also developed our own indicators to know what they are happening and what they are facing in the current time, I think. I don't know. Is it okay for you? Thank you.
I think around for and I think the other question is for me about the triple burden disease. So I think first of all, I think for undernutrition I've mentioned a lot, and there's a figure I showed about the the nutrition sensitive nutrition specific intervention that work as a whole multi-sector collaboration. But I think it's a privilege for us to have our dean Professor Haijun Wang here, and she's a very big expert on obesity and overweight. I think if we have the privilege, I would like to add some bonus for you to invite our dean to provide us some introduction about child obesity interventions in China. I think it's very interesting.
Okay, thank you. I just want to show, because for childhood obesity, we all know how to prevent it in very small samples. For example, we can give the dietary guidelines, or we can also do health education, and also we can do physical activity enhancement, and we need some psychological support to them as well when they try to lose weight or control weight. But the problem is that in the whole world, we met the problem in the large-scale population. How to reduce or stop the increase of childhood obesity prevalence, the increase. We all know, and now I'm working with the experts in the world to try to figure out this problem, because many interventions study in high-income country, but we could see in Cochrane Review recently just published, you could search for that, especially for school-aged children. There are two reviews in Cochrane website, separate for 6 to 12 years old, another for 12 to 18 years old. But you could see is somehow struggle for all the researchers, because the result is no too little evidence for effective intervention. So I think for all participants in this room, we could think about why there is no too little evidence. I think the problem is that we really don't know how to implement intervention in the large scale population. And in China, I have done, we have conducted several national programs to study the effective intervention package, how to make it possible and effective. And I have published, our group have published a paper in JAMA Pediatrics in the beginning of 2022, and we have large-scale intervention effective in 3 regions in China, including Western, Middle, and Eastern region. And our experience is that maybe because we use not traditional intervention components, but also digital technology with the APP in mobile. And we found it helps to get more visible and get higher adherence of the parents and the children. And if you are interested, you could search my name and search JAMA Pediatrics 2022. You can look at the paper, and we think it might be possible in our large population to use mobile technology and the traditional intervention. It might be helpful, but we still need other interventions. We still need interventions in other low and middle income countries. Yeah, we hope we can collaborate in the future. Okay, thank you so much. Okay.
Yes, thank you.
Thank you. I just want to add up one thing. The reason I think, because the reason why we come here is because we think we have done a lot of different research, but we still think it's very important that we could have the opportunity to collaborate with our scholars from Indonesia. It's because some of the interventions are similar, some of the challenges are similar, and if we could work together, we could provide more evidence-based suggestions, not only for our own population, but also for the populations that we are facing the same challenges. Just want to add up this. Thank you.
Okay, thank you. Please, okay, the last one from the left side.
Okay, so everyone, good afternoon. My name is Nurul. I'm actually not coming from health department, but I'm coming from political and science department in international relation. But now I'm really interested in health sector area and policy, because it's actually personal for me, especially in non-communicable disease or diabetes issue. Especially in low and middle income countries. And I'm really interested in our discussion in our 3 professors that have been presenting their materials. So I just need your insight about the issue, because now currently I'm writing about a WHO role to combat diabetes in ASEAN, especially in 3 countries, in Singapore, in Indonesia, and Cambodia. So there are high-income countries and low-middle-income countries. As we know that you guys are mentioning about nutrients, about adolescents' health, and also about another disease, which is malaria in Indonesia, because we all know that in middle-income countries like Indonesia, the burden of disease is not only coming from infectious, but also non-infectious disease. So for Pak Doni, just want to know, what do you think about the priority right now in Indonesia or in middle-income countries globally? Because we all know that the most cases that kills people are the non-communicable disease like stroke, heart disease, and also diabetes. But like malaria is it's like a burden for Indonesia. I just really want to know what your insight or what you think about this fact, like maybe funding area or anything you can share. And also about Prof. Yang Mu Huang and Prof. Song. We are Asian, right? All of us here. So in many research about health that I read, that Asian is more sensitive and have high risk for having some metabolism issue like diabetes. So what do you think about this in a public health sector? So thank you so much. Maybe the same question for 2 of you. Thank you.
Okay, thank you.
Thank you very much. Yeah, thank you very much. I think Indonesia has double or even triple burdens of diseases. For communicable diseases, well, in SDGs, we have goals to eliminate certain diseases like TB, malaria, and HIV. And now in Indonesia has in many districts reached the level of elimination. And we need to have, I mean, this is the last miles. If we don't invest on that, it will re-emerge, and especially for malaria, if there are for a long time no malaria presence, it will be a huge outbreak because of the way the immune response for malaria disease. It will have a huge outbreak because of low immunity in the population. And when we have a huge outbreak, then that's back to square one, because then it's become a big problem. So I think we need to finish these last miles and somewhat prioritize those issues, and we can move on to other diseases. But that's really also hard things to do, because again, we are not a rich country. We need external funding for that. But at the same time, we have the global funds, for example, they will not there forever. So and they will have their money. I don't know whether run out or not, but the commitment is not for as long as we need that. So we need to find a different way to make the resources available, probably within the country, probably from the private sector, probably from the philanthropy, because there are a growing what you call the middle or high class individual who willing to contribute for the betterment of the society. So that's my take. Thank you.
Thank you. So I'll sit with you. So actually, thank you for the question, and I feel very delighted to have you here, because in Peking University also we have very close collaboration with international studies and many of the other from social science and I think it's very important that you could join the health studies. And regarding to the question, I really agree with the professor that even though communicable diseases or infectious diseases are still the priority, chronic disease is going to be a huge challenge, especially for vulnerable vulnerable populations, because the access to medicine and everything, the combination of chronic diseases with infectious diseases will be a very big challenge. So I think it's very important that we start from the very beginning, and it's already a very big challenge around worldwide for chronic diseases, including, non-communicable diseases, including the diabetes, as you mentioned. And also, I think sometimes, because I'm teaching global health in my department, people always think that only infectious disease are global health challenges sometimes, because it cannot be transmitted very fast. But from my point of view, I think NCD is also transmitting very fast, because health determinants, social determinants of health, things you're from the social science place, I think transmitted even faster with all those social medias, bad health behaviors, not only, health, eating fast food, drink a lot of sugar added beverages, all these transmit very fast. And so this something requires, the combination or the collaboration with all the different countries, including private sectors. But I have to tell you the truth, because every year we go to WHO for World Health Assembly and the Equestrian Board as Chinese delegations. I still feel that infectious disease or emerging infectious diseases or pandemic, everything, they're the top priority for the international organizations. The reason is because it is a long way. There are so many international organizations such as Gavi, Global Fund, among others. They build up for infectious diseases, but currently not many build up for chronic diseases. So the elevation, the advocacy, the resources, of course, they're going to infectious diseases. And because it's more easy to see cost-effective benefits, so it's easier to get donors to support. I think these are the challenges that we have to think. We have to think new financing mechanisms. We need to think new advocacy, strategies for them to focus more on chronic diseases. But the situation there, people already witnessed that. But for example, for WHA, there are so many interventions on infectious diseases, but always one intervention that is under the UN high-level meeting on chronic diseases. So the awareness is there, but we need to work harder for them to understand this situation. So I think it's very important for you to join, us from the very beginning.
Yes.
Yeah, I think they talk too much for that questions, and I'll just add something I could offer. That I should say that it's a good question, not for you, but also for the global experts. That the Lancet just published one very important publication, used the GPT data to project the next 20 years the disease burden, and also to forecast that NCDs should be the very important proportion across the world. Not only for middle-low income countries, but also for the high-income countries. But I think that what's important is that we should into two perspectives for that questions. That for the government, that we should make the policies to ensure everybody could obtain benefit from that kind of questions, that kind of policies, because it means health equities. But for the individuals, that we should take us on responsibility, that means you can afford your health. And we also could reconsider about the health. What is the health is not the issues, but also the investment. You should invest in your health, which not means health, but also the fortune. So if the government and also the individual could think that health is not the issues, but also the investment, and we can manage the trade-off to what can we do for health and what the government can do for the health, we can think about it's an opportunity. So that's my answer. Thank you.
Yes, please give applause to our speakers. Okay, I think because we already past 11, so let me give a wrap up for our guest lecture. So thank you for all of the students that have a discussion in this session. So from our three speakers, we learned a lot. So from Pak Doni, we learned that from a natural bacteria, we can then develop intervention for dengue, and it's already being established and implemented in 5 regions outside of Yogyakarta, and hopefully it will help us into reducing the number of dengue cases outside of Yogyakarta and hopefully for Indonesia. And then from Dr. Yang Huang, we learned that there is a needs to establish further implementation when there is when the nutritional package program is ended. So that's why health education is also needed, not only the intervention by using the yin yang bow, but health education also needed to prepare when there is the implementation is over. So the family is already prepared, that they know how to give a complementary feeding. And then from Dr. Yisong, we learned that there is a growing evidence that adolescents we need more attention to this age group, the adolescents, because this is a pathway to the adult. So we don't treat those adolescents and we don't have a good monitoring surveillance about the health, then there is a risk that we will have a missing generation of adults, because the adolescents is they now having a severe burden of disease. I think that's all from. Or you have any? Good photo. Okay, we will have that after this. Okay, then I think that's all from me as a moderator. Thank you, Dr. Yisong, Dr. Yang Huang, and Dr. Doni for the great presentation and discussions. Thank you. And give back to Mbak Kiki to have group photo.
Thank you. Please give a round of applause to our speakers and moderator today. Thank you, Pak Bayu, Pak Doni, Prof. Yang Huang, Prof. Yisong, and also Prof. Haijunhua. Yeah. Okay, maybe you can take a seat. Yeah. Okay. We also appreciate all of the participants for joining and engaging with us in the session today. Very, very interesting and very, very insightful session we had today. And after this, please do not leave the room immediately, because there will be a photo session first with all the speakers and participants. And once again, we would like to say thank you, and we also deeply apologize if there's any mistakes occurred during the event, and we will look forward for your participation at our next activities. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Yeah, maybe from Kana.